Hello, ATG. This is Dr. Esther, one of the admins at AsktheGynaecologist. So today, I didn't want today to go by without me doing this. I was supposed to do it some time ago, and I couldn't do that on Saturday like I promised I was going to do. So I just had to do it today. So I know a lot of people are sleeping, but I just have to do this today, and so I don't keep taking it over and over. So if you're online, okay, whoa, I still have 23 people that are not sleeping. Okay, so you can just say something as usual. Let me know if you can see me, if you can hear me. So I just want to talk about, Oluchukwu is online. So good evening, Doc. Good evening. Thank you so much for joining me. And please, as usual, tell me if you can see me, if you can hear me, so I can have an idea if I'm doing well, if there's anything wrong with my internet, my Wi-Fi, or so. So I'll be waiting for a good number of people to join in. Wow, there are so many ATGians that are not sleeping. I mean, and you're supposed to be sleeping. That's part of my preaching. All right. Chioma is also saying, Chioma Rita is saying, good evening, Doc. Bright is online saying, good evening, Doc. Thank you very much. Please, I need someone to say, thank you, Chioma. I believe you want to say I can see and hear you, because they said I can't see and hear you, but I believe you can see me. Someone says all clear. Thank you very much. So there's been the issue I wanted to talk about, cesarean delivery and and vaginal delivery. So I just had to do this. Thank you very much, Azizad. A lot of people are saying I can see you, Doc. I can. So I want to try to make this as brief as possible, and then I can take some questions. So I'm going to encourage you to hold on with your questions to the end of the presentation. Then I can take some. Someone is saying the audio is low. But I think I'm talking at the peak of my voice, though. I don't know. Can you increase the volume on your hand too? Like, normally I'm naturally the loud talking person, so I'm assuming this is supposed to be loud. All right, so I'll be starting. The cesarean delivery, vaginal delivery, which should you go for? What is it? The truth about the matter is I'm going to define them. The vaginal delivery, as the name implies, that everybody knows, that is the birth of the baby through the vaginal canal. And the vaginal delivery, I'm going to call it, for the purpose of this presentation, that is the natural way. Dr. Alalade in one of his presentations made an analogy, and that makes sense. So I'm going to be making reference to that analogy frequently during this presentation. So vaginal delivery is the birth of a baby through the vaginal canal. So a baby goes through that. That is the natural, that is the expected route of delivery. And so what is cesarean delivery? Cesarean delivery is the birth of the delivery of a baby through the abdominal wall, from the abdominal wall. So it is a salvage method of delivery, and that's what I want to use the term. Vera is already asking a question, and I can't. Your question is not even related to the topic, so I won't take my time to answer you. So hold on with your question to the end of the presentation. So cesarean delivery is a salvage method. It is not a primary method of delivery, and I'm going to be hammering on this. Anybody that has been following us in ATG, you get to know that ATG is not anti-cesarean delivery. As a matter of fact, we are pro CS, but we just want to be sure, in a world where things are beginning to, fly everywhere, things every now and then, you hear people, my delivery method, C-section, or sometimes you find members in my ATG ANC, I'm planned for CS, or my doctor said I'm going to have CS. What is the indication? And they'll say, the doctor said because of this, and I'm wondering why. So there are supposed to be indications, so you can be enlightened, and that has been what ATG has been found to be doing over the years. We've had people that has been enlightened, people that will say they've been to their doctor, and the doctor will tell them, I think you must have been to ATG for you to be talking is knowledgeable. It makes us proud, that we are passing knowledge. People get to be enlightened. It makes it easy for you to discuss with your provider. You get to know. So what are things that are indication? And the reason why I have to do this is so that we're going to be the fence between sense and nonsense. So you don't come from a place where you get to learn that there's a way beside vaginal delivery, and then you don't go overboard. And that is the place where people just want to opt for cesarean section, opt for cesarean delivery without indication. It is good, it's your choice. I was talking with a member, it's your choice, definitely it's your body, your choice. But I just have to inform you and let you know the complications that may be involved. So it is okay. And the analogy that I made in the comment section with some, that I got the analogy from Dr. Jide, it kind of makes sense. When you're in your house, you're in your house, and then you want to come out. The baby is in the house, which is the womb. The baby needs to come out. The vagina is the door. How is the child supposed to come up? The child is going to pass through the door. The vagina, everything being equal, no problem. The child is fine. The child is not. There is no distress. There is no fire alarm. There is no snake in the house. Nothing is going wrong. Everybody should walk through the door. Walk through the door. That's the vaginal delivery. Now, let's say the house is burning. There is fire in the house. Something is burning. And it's burning so fast, or there's flooding, or a lion came into your house. I'm just trying to make an analogy. Something of an emergency happens, and you need to get out of the house. And the thing is in front of the door, or the thing is happening, you can't get out of the door. Then you break the window and you come out. Does that make coming out through the window? Someone else says, why would you come out from the window? You should have come through the door. That doesn't make sense. There is fire on the mountain. You needed to go out, and then you came out through the window. You had to save your life. That is what cesarean delivery is. There is fire on the mountain. The child needed to come out, or the mother there's going to be a problem if the mother does that. And then the child comes out through the window, which is cesarean section, like through the abdominal wall. That is it. That is what it looks like. Does not make it wrong. No, in any of these two scenarios, none is wrong. Someone came out through the door, another came out due to a valid point, came out through the abdominal wall, decided to come through the window. Both of them needed to stay alive. They are both out. But the problem, where we're going to have problem in medicine, and that's becoming popular, including here in developed part of the world, and where we also call developing, in the United States, in United Kingdom, and in Nigeria, it's becoming so common. We are seeing members beginning to want to shame people. You don't want to get CS. It's cool to be, to take pride in, in your scar and everything. But it's going to be wrong for you not to have an indication. How do you just see someone? You just wake up, nothing is wrong in the house, and you decide to jump out of the window. Why would you do that? Why do you just want to jump out of the window? It's your choice. It's your house. Definitely, you can decide to jump out of the window, but you're going to get more wounded. Do you get? I just want to make the analogy so you get to understand what we're saying. So the analogy should stick more. If there is a reason why is there's a reason why you have to have the cesarean delivery, it is okay. But it is. I have to make you more knowledgeable that it's not just something that is wise for you to just choose. I just want to go for cesarean delivery, and I'm going to be pointing out some of the complications and the reason why you have to, the reason why you have to consider it, the reason why if you are just, it is vaginal, it must be vagina, it has to be Hebrew women. You got to think. And then if you're those that want to be, I want to use that term, woke, you just want to, it's like it's becoming fashionable. You just want to go for CS. No. Think it, rethink it. So you got to know that there's a baby crying in the background. Please pay attention. Baby's crying, yes. Pay attention to the stuff. I got 2 babies that are going to cry any moment. So I'm trying to concentrate. So please let me also concentrate. Don't remind me of the baby crying. I got my mom watching. So now, like I was saying, now there are going to be indications. There are indications why you should have one. So I'm asking, like people are beginning to ask questions, and I'm not be able to answer. I'm going to swipe so I don't see this question, so I can pay attention to what I'm doing. So, like I said, cesarean delivery is the delivery of a baby from the abdominal wall, through the abdominal wall. So you're going to have like a laparotomy, and then there's going to be an hysterectomy, that's cutting of the abdominal wall, and then there's also a cut on the womb. The baby is gotten out, and then the womb is repaired. The abdominal wall is repaired, all of that. This is necessary. There are indications for it. It is one of the life-saving method. The origin of cesarean delivery used to be, it started as a method to deliver babies that probably the mother died suddenly, and they discovered the baby is still alive. So they quickly just cut the woman's womb and get out the baby. That was the the very origin of cesarean delivery, for which a mother died and the baby is still alive. They quickly want to get it out before the baby dies too. But it has evolved. So many conditions. You have discovered a lot of women die in labor, because the baby gets stuck. They are contracting and contracting. Baby is not just coming down. There are some cases where you have arrest of labor. Baby is not, despite adequate contraction, baby is not coming down, like cephalopelvic disproportion. So many things. Cesarean delivery has been found to help and save women. And some of these indications still stand. So I'm going to be talking about the indication for cesarean delivery. Now note, if you don't have an indication, none of this indication, you should opt. Normally, it is expected for you to deliver through vaginal delivery. It is not for some. Now, in the case where you have maternal request, that's what we call it, maternal request for cesarean delivery. Those kind of cases exist, and it's okay. It's a choice of the patient. The patient has a right over their body and can decide, I want a cesarean delivery, and that's fine. As a physician, yes, the doctor is going to agree with you, but it's also right to let you know the complications that can attend to it, and then the fact that there are some consensus. The fact that you want a delivery doesn't mean your doctor is just going to automatically just the way you want it is the way it must be. There are some guidelines that, as a doctor, you follow in your practice also. So there are some indications for cesarean delivery. And I want to try to just break some of them down. Like you have maternal indication, you have fetal indication, and some that has to do with mother and child. Like for maternal indications, you want to talk about a previous cesarean delivery. So because the mother has had a cesarean section delivery is a kind of relative indication, because like we say, normally a womb that has a scar that has been cut is not so reliable, not so dependable. But there are some factors for which you can now make such a woman try vagina, and that is the VBAC, vaginal birth after cesarean delivery. You can have that, and there are supposed to be some criteria to meet. If a woman has had cesarean section before, a chance of having another one is increased. So if you opt for one now, there's no indication you just wanted cesarean delivery. You should consider the fact that you may need to keep doing it because you have already heightened your chance of having cesarean delivery. So that's one of the indications. A repeat cesarean delivery, cesarean section. It is from also on the maternal side. If you have any obstructive lesion, that's what we call it. Like you have a fibroid that is low in the womb, kind of in the cervix, that is blocking the part that the baby is supposed to come out. The baby is supposed to come out through the vagina. Maybe there's a fibroid, either a pedunculated one or a big one in the cervix. It's not going to allow the baby pass. That is an indication for cesarean section. There are big warts. You don't want the baby to catch warts. There's genital warts or so. Those can be indication for a mother that has had probably prolapse before, a vaginal prolapse, or she has had pelvic surgery before that. You know that going through labor or pushing can cause her to can make the old surgery can negate everything. This can be an indication for that. So another on the maternal, on the fetal side, the child is in the commonest one, like I said, is fetal distress. You went to hospital, or like some people, like some women, some of our members, in the ANC, they're going to tell you, I just noticed my baby is not moving, and then they get there, discover that the baby is in distress. Is that the heart rate is coming down or is super high? There's something, and then they check and they discover that maybe there's even meconium. The child has pooped. It's not normal. You don't find that. So you get to know that this baby, there is fire burning. This baby needs to get out. That's the example I made earlier. And the fastest way you can get this baby out, get the baby out through the window, cesarean delivery. The child needs to be happy. The mother needs to be happy. Everyone is happy. That is it. That's the power of cesarean delivery. It's helping, it's saving life. There can also be an issue. You have if there are any conditions, there are some abnormalities in the child that likely may not be able to make the child withstand the stress of labor. There are some that should not be, because if you want to try as much as possible. If a woman has a dead child, you want to make them go through cesarean delivery. The child is already dead. You don't want to add to the pain. You don't want to add more. So you want the child in such cases, you want to try as much as possible. The woman has a vaginal delivery, but there are some conditions you don't want the child, like a child that has a neural tube defect. You don't want the child to, or there are some more conditions. There are some abdominal wall issues with the child that the child cannot go through the rigor of vaginal delivery. You want the child to have the mother to have cesarean delivery, so the baby can be fine, the mother can be fine, everyone can be happy. What's that noise? Okay, so you can also have I mentioned fetal distress. I mentioned what's it called, some abnormalities in the baby. Then some factors that may add both mother and child, like I mentioned earlier, cephalopelvic disproportion. The baby is so big for the pelvis of the mom, or there's such an arrest of labor. You need to have a cesarean delivery, because if there's an arrest of labor or there's such a cephalopelvic disproportion, the woman is contracting enough, but baby is not just descending. You just discover that is not progressing. Labor is not progressing. That child needs to come out through cesarean delivery, because if the mother keeps doing that, so that's what's happening with some women. They are contracting. They will be in probably faith home. They will be with TBA, traditional birth attendants. They are contracting adequately, but they keep doing that for days until we call them obstructed labor. The woman is contracting until one time she just feels like, I think I feel better. When she feels better, that was like it was her womb that ruptured. The woman will say, I think I feel better. You really know that our remaining time on earth is beginning to count, because when the womb rupture, there's bleeding everywhere. The baby may be dead or before So a lot of stuff like that. You can have like cephalopelvic disproportion is an indication, both mother and child contributing. You can also have like another maternal indication that I forgot, a contracted pelvis, a woman whose pelvis is so small, it's super small. You're already suspecting, or there are indications, or the mom has some deformity that are visible for you to know that a child may not be able to stay, go through this pelvis. You need cesarean delivery. So there are so many conditions. There are some indications for which cesarean delivery is. Some other people will mention twin. It is still being debated, twin. If a child, if a child, you have different type of twin, for a monochorionic, amniotic babies, is almost always cesarean delivery, meaning those child, they share one placenta, they share one sac. These babies, they are so together, they are so tangled. It may be so difficult performing having them go through vaginal delivery. The chance of losing the other baby is so high, because when the first baby comes out, the decompression in the womb cannot actually cause the placenta to give. The placenta can detach, and there's another baby there. You have cut off supply to the other baby, so the other baby may be at risk, or somehow the baby can get stuck or so. So for a monochorionic monoamniotic twin, it's almost always cesarean section. Now to the next kind of difficult one is like the monochorionic diamniotic, meaning the babies, they share one placenta, but they're in their different sac. For that, depending on, different factors, you may have some things. If a child has twin-to-twin transfusion, there are some other conditions, cesarean section straight. But if both twin are head down, or the leading twin, the one we call leading twin, that's the baby that is coming out first, is head down, you can still give a try for vaginal delivery. In that case, though they have one placenta, then they're different sac, babies may still, be able to keep the womb open. So you're thinking about that. The other baby, the sac has not ruptured, even though the first baby comes out, so that gush of water out, the other baby is still able to, the sac of that other baby is still able to keep things in place. So you can buy time, though you may actually end up in emergency cesarean section. In those kind of cases, if you're delivering a monochorionic diamniotic baby, you want to deliver them in the theater in case there's anything goes wrong. The placenta detaches, or you started seeing that the other babies, their vitals begin to go haywire. You want to deliver the other baby fast. So that's also an indication for cesarean delivery. Now the third type of twin, the that has a diamniotic, dichorionic diamniotic, two different babies. Those are the ones, the fraternal babies, fraternal twin. Everyone has their sac and their placenta. This one has a sac and its placenta. Try, as long as the leading twin is also head down. For any of the type of twin, once the leading baby is breech or in any other condition, is an indication automatically for cesarean delivery. But if the leading twin is head down, consider you can have a shot at vaginal delivery. All over the world, the rate of cesarean delivery is high. It's very high. So, and then there's been course for how about regulating the way we keep taking women for surgery. So cesarean delivery is a major surgery. There are complications, and I'm going to be talking about that after now. What are the complications of cesarean delivery? I've told you, I've mentioned so many conditions where CS is saving the life of women, it's saving the life of babies. So you can see why cesarean delivery is important. But for every surgery, just like any surgery, whether it's minor or major, and cesarean delivery is a major one, there are complications. The complications can be from the anesthesia that is used itself, or can be from the procedure. from the surgery. So from the anesthetic point itself, you're as much as possible, except when necessary, you don't want to subject patient to surgery except it is adequate or it is absolutely necessary. Because you can actually, nobody knows who is going to react to the anesthetic agent. You don't know something. You hear people go into, I don't want to say some other things that scare people. So some other complications are like infection. It can be of the womb lining. Some things may go wrong. Sometimes the doctor is talking while having surgery. There's some saliva dropping in. That rarely occurs, but for any reason, infection can set in. The endometritis can occur. That's the lining of the womb. There can be infection in, can be the wound refusing, the wound site, infection of the wound site. Sometimes even the wound is beginning to heal, or it ruptures or opens, scar dehiscence, all of those can occur. They have a higher chance of those happening. Some people will say a lot of complication. I've seen women that have complication with vagina, but definitely anything has its own risk. But relatively to vagina and cesarean delivery, there's twice the morbidity and mortality is higher with cesarean delivery. So except it is necessary, you just don't, out of the fact that it's just fashionable, I just want to have cesarean delivery. Remember, it's your choice, your body, it's you. It's just fine. So I know some questions that are going to pop up after now is going to be, I've had cesarean delivery before, now I want to have vaginal birth. There are conditions that you must meet for that to occur. Like I said from the teaching, if you're following me, I said cesarean delivery already predisposes you to another one. So if you've had a cesarean delivery, your chance of having another one is already higher. So some other complications, before I now go to VBAC, some other complications that occur with cesarean delivery, for future pregnancies, you have higher rate of placenta previa. That's the placenta lying low in the womb. Or another one that is usually even more feared is a placenta accreta, where you have placenta implanting on the place where the womb was cut. And during delivery, it becomes difficult for the placenta to detach. And then the surgeon has to, this usually should have been picked up during ultrasound. But if it was missed during ultrasound, if it is just found during delivery, the woman can bleed, a lot of bleeding, because you have to make sure you're able to evacuate it. And if there's so much problem getting the placenta out, especially if it's a kind of placenta that I call placenta pacreta, the placenta decided to go all the way in, that one is, in pidgin you say na die. So that one is a placenta that came to mean business. Sometimes maybe the bleeding may be much and the surgeon may need to take out the womb. So some of this occurs, some of the complication, and then the blood loss, blood loss occurs with cesarean delivery. It is higher than with vaginal delivery. Some of this complication, like I said, infection, everything can occur with vagina. It can, but it is higher with cesarean delivery. So it is necessary. Before anybody starts saying I've had vaginal delivery and I've had cesarean delivery. So it's not like I had to do cesarean delivery because it is necessary. So it's not like I'm blowing some women down or so. And it is my responsibility to also tell you the truth. So if for any reason you're fine, you're okay, don't just listen to what happened to someone, this person died, so I'm afraid of labor, I don't want to have that pain. If you're so afraid of the pain, there's a epidural that comes to your rescue. So if there's a reason for it, you don't say I want to try. You said the mortality with cesarean delivery is high, I want to try, I must leave a vagina. You may not be here to come and tell us the story because you may be gone. Like I told you, once there is fire on the mountain, you need to stay safe. Cesarean delivery comes to the rescue. So think about that. It has to be. So some others, some other complication also can be there's such a thing as clotting. After surgery, there is anytime you have a pelvic surgery, there's an increased risk of clotting occurring. And then with a woman that has had surgery, with cesarean delivery, you're not able to actually stand up almost immediately. Sometimes you're still in pain, especially if you're not on top of your pain medication. So most women don't want to move around because of the pain. And the longer you stay, lying down or not moving after surgery, they have a tendency to form clots. And those clots, if they get to detach, go into the lung, you can have pulmonary embolism, some other kind of stuff that language I'm going to want to leave, so a lot of some of this stuff, you got to pay attention to it. So your doctor is going to tell you something you look out for. Some women also, you have your catheter, if it's not quickly removed on time, higher risk of urinary tract infection and all of that. Like I said, a lot of these things can happen with vaginal delivery. Once pregnancy itself is a coagulable state. It's an hypercoagulable state. It makes it easy for women to form clot. So compounded with surgery, it just makes it higher in cesarean delivery. So a woman who just deliver vaginally too can actually form clot. So there are some conditions where a woman may not go through. You can't go through cesarean delivery. Like if a woman you have a compromised lungs, if the lung is not strong enough, you can't vouch for the lung capacity or so, or you have some heart conditions that makes it so hard for the woman to, it's going to be so much for the woman to go through. There are sometimes you don't want to do cesarean delivery, or if it gets so bad in that aspect, you ask the woman to actually stop delivering, because sometimes it becomes very dicey. What should I go for? Should I now ask this woman to go for vaginal delivery? I'm scared. If she goes for cesarean delivery, what if she doesn't make it out of the surgery? And, it now becomes between the devil and the deep blue sea. So I'm doing this to inform, so we can have, informed, informed decision. Just don't make it like my friends are having, some people, my friend, they had, CS. I'm just going to go for CS straight now. I want you to rethink that. If you don't have an indication, give vaginal delivery a try. But like I said, it's your body, it's your choice. It just has to, knowledgeably give this knowledge. So I want to talk about vaginal birth after cesarean delivery. Okay, someone is saying, doctor, and that's about just, I know that question is going to come up. So I said, please, assuming the C-section has been up to 4 to 5 years, is the womb still at risk for vaginal delivery? I don't understand. I don't know if you mean, is the womb still at risk of rupturing? Once a womb has been cut before, you can never trust a womb that has been cut, like a womb that has never been. So once you have been sectioned before, your chance of going through labor successfully, vaginal delivery successfully, increases if from the last delivery to now is up to 2 years. Your chance of, that means you're kind of looking like, okay, you allow the womb some time to push. But that still does not mean, as a doctor, I'm going to be watching you like a hawk. I just want to be sure this womb does not give way on me. So this one says, can you talk about epidural? Do you mean epidural? Maybe epidural anesthesia. There's no epidural section. I think it's epidural anesthesia you're talking about. But let me talk about, so no matter how long a womb has been, has gone through, has been sectioned, it still has a likelihood of rupturing, of having that, rupture or descent or so during labor. So you're still going to watch. But the longer the time, the higher the fact that, the higher your chance that you're likely the womb is well healed and you're able to push more. So for a woman, if you had cesarean delivery and in less than 1 year, you already conceived, you already made yourself a candidate for a repeat CS, because nobody is even sure that the womb is well healed before another pregnancy. So the shorter the time, the higher the chance of having a repeat. So some say, doctor, what if it's multiple babies, like 3? Triplet is like an indication for cesarean delivery. Yes, those are. Does CS affect the chance of getting pregnant again? Everything being equal, if there was no infection, I mentioned some things that could be complications that can go wrong. If you had severe bleeding, there's such a thing that sometimes a woman she bled so much, and then you have a condition like Sheehan syndrome, so that the bleeding was so much and it affected like a part of her brain. Somehow, that kind of woman, you discover that she does not menstruate again, she does not lactate, she cannot breastfeed her child, she may have issues with fertility. If endometritis occurred, there was infection with, the womb lining or some other infection, the wound, and, so many things matted together or so, there may be delay in getting pregnant again. But if your cesarean section was done by a doctor, by a gynecologist, a real doctor, the rate of infection, the likelihood of infection is actually low, because sterilization and all these sterile techniques are being put in place. Some are there complications that comes with epidural ahead of spinal injuries. That's very rare. Like I said, the reason why it's not so much, a lot of women say, so someone asked me today, why is epidural not so common in Nigeria? Because you don't have enough hands. You don't even have enough doctors to start with. And part of the doctors are ATG doctors. They're not running away. We are also here helping people. So we don't even have enough. And then we don't have enough specialists in anesthesia. So you have lower number of doctors that are going to have to, perform these procedures and watch women in labor, if you want to have labor. So there are, like anything, spinal injury is very low. If your doctor is doing that, even, I mean, I don't even have to be an anesthesiologist. There are places that I know you should not put. So except a quack is performing it for you. Spinal injury is one of the lowest things you want to think about. But there are some women who complain of headache, you know, some people may have some numbness. Some people may tell you that, you know, the place where they had a wound, they keep having some pain, you know, at that point. But it's very rare. You can have, you know, some degree of, what's it called? Some degree of pain here and there after now and then. But most people, in most cases, like I said, some of these complications I mentioned, most people don't have it. Most. But, I mean, the ones that have it, they may not be, so, you know, they may not be here to bear witness or have anything. So, someone says, how do we deal with keloid after CS? Because mine is very big. The truth is, you forming keloid has nothing to do with your surgery. If for someone like you, you want to avoid having anything that will have to heal. Because anytime you have any injury, whether you have a hair piercing or you have anything that punctures your skin and your body needs to heal, you likely will form keloid. Because that is your body. Your body is kind of having this increased production of collagen. So it is not due to whatever your doctor did. It's just how your body was taking, you know, how your body is healing. It's a genetic thing. It's about your makeup. So someone says, Doc, please talk about vaginal birth after 2 CS. Thank you very much. After 2 cesarean section, it is always cesarean section. No vaginal delivery. If you have got a womb twice, don't trust that womb. Don't trust it one bit. Some people, I know the next set of people is that I have a neighbor that every time you say something about science in womb, someone in this group, someone will say, but I know someone, or I know someone, that kind of statement. I know someone that had 3 CS and then she delivered vaginally. She got lucky. You may not. But like I said, it's your body, it's your choice. But I'm here to just state what it's, I don't know, I'm here to just state science. After 2 cesarean delivery, please think it's always cesarean delivery. Doctor, please can you throw a little light on what causes heaviness in the womb during pregnancy, even with sacrilege? The womb is heavy, so you're going to feel heavy. Your baby is growing, so you're going to feel heavy. But if you think it is an abnormal thing, maybe you're feeling your baby is so dropping in your vagina, you may want to go. If you have a sacrilege in place, that should keep the womb closed. As the baby gets big, you're going to feel heavy there. So once after the CS I did 4 years ago, I've had 2 miscarriages, and now I'm experiencing pain on my navel region during my menses. Okay, so could it be the CS? During your menses, the pain you are having during your navel region is making me begin to think there may be something else. You know, one of the things that may be common is that maybe there's an endometrial tissue that is there. You may have had endometriosis. It's possible, and it may not just be, and it's possible it's due to, you know, adhesion. Like I said, part of the complication, I missed that out, is adhesion. A lot of people, you had a CS, it was uncomplicated, you are fine, you're just okay. But some of the long-term complication can be adhesion. Sometimes, you know, be careful of the womb, because the womb, the healing, sometimes some women, between their womb and their bladder, they can have adhesion, you know, it's joined together. So sometimes they may have issues with bladder issues later, you know, or some can be, you know, the adhesion can be between the intestine, you know, sticking to the womb, one part of another intestine sticking, and, you know, stuff like that. Whatever there is tissue handling, there can be some sort of adhesion. Those part of the tissues, they can get glued together while they heal. So adhesion can be, and it's possible there's a part of the womb and the intestine, and then the pulling during the contraction during your menses can make you feel that kind of pain. So you can look it up. About the recurrent miscarriage, I may not be able to talk about that. So you need to have a follow-up with your doctor. Doctor, can one have vaginal delivery after 1 CS done 3 years, 6 months ago? Baby was transverse then. You can try it. Once you've had cesarean delivery once, if every other thing is fine, you know, the reason for which you had, like you said, it was due to transverse lie. Transverse lie may not reoccur, but if your next baby comes again and is transverse, it means your baby they are pushing you for cesarean section, so you likely will have it. But if like the cause is not, you have another baby and the baby is head down, you can try vaginal delivery, and then the baby is not too big, the pelvis is okay, you don't have any condition that can compromise your health, you can be given a trial, you know, of Doctor, does vasopressin tablet reduces high BP during pregnancy? No, it does not reduce it, but it helps prevent it. And then is an antiplatelet. It helps prevent blood clot in pregnancy. Please, doctor, someone that had 1 major surgery and 1 CS, can she deliver through vagina? What kind of surgery? What kind of major surgery? Say she has had 1 CS and 1 major. I don't know what other surgery, 1 major it is. But if you've had in this context of the vaginal delivery we're talking about, is about the womb. If she has had a surgery, the other major surgery she had is on the womb again, so she's not a candidate. But if maybe a surgery, maybe she had appendectomy, she had a liver, issue, and she's well ill and she's fine in her health, sure, she can still try. But all of this, even the vaginal birth after cesarean section, is up to your doctor. If your doctor is comfortable with it, it's not like, I'm in ATG. They told us that after 1 CS, I can have vaginal delivery, and I must have vaginal delivery. Your doctor may not be. If you don't have facilities to be able to monitor a baby, your doctor is confident enough to be able to handle it, you can't force it on him. It is still, he also has it because it's going to be on his record. Let's say something goes wrong. The next thing I know most people will say is God forbid. But if anything goes wrong with your baby in that doctor's facility, the same people are going to come back. This doctor knows how to work. Meanwhile, you are the one that said it must be VBAC. If a doctor is not so okay with it, is not so sure about it, so I mean, if it is a repeat cesarean section, go with it. Doctor, please, in a situation when someone sees a period each month, but the doctor is saying there is no egg. I don't know what you mean by there's no egg, or does it mean that she's not ovulating? There's more. In that kind of case, you need to see a gynecologist. And then what's the gynecologist saying? You need to have a diagnosis. This kind of talk, it doesn't sound like you're working with a gynecologist, because I really don't understand. It's not so straightforward. Work with your gynecologist. You will. And if you've had a problem, if you have issues, with infertility, consider subscribing to ATG Premium. We say this a lot. A lot of people just think, just want money. Definitely, this we're doing, you're also taking your time out. I'm taking my time out. It's looking free, but it's also part of my money. You're also spending money. But for the knowledge we're given, is our commitment to our premium service member, to our premium subscribers. Subscribe if you have issues, you have issues with infertility, or any case you want a one-on-one consult and you want to be guaranteed. Like, there's so many questions now that I'm talking, there's so many questions going up my screen. I'm not able to answer your question, and not because I decided not to answer your question, but because I can't answer everybody, definitely. So one way you're going to be guaranteed to get a response, to get consultation, is through premium service. If you're pregnant, a lot of people are pregnant, they rather prefer to come to my inbox. And sometimes I'm only seeing the message like God knows how many months after. That should not be. If you're pregnant, ATG ANC, ATG Antenatal, you should be there. I mean, 5,000 throughout your 9 months doesn't look like something that is expensive to me. You get all the knowledge. In ATG ANC, a lot of women, you have saved so much more. A lot of people, they would have had to buy expensive drugs. They would have been asked to buy things that they don't need. That ATG Antenatal, we have saved women from. If you're pregnant here, you should be in ATG ANC. And then you don't have the money for premium service. You can apply for that 1 year, There's a platform where other women that are going to conceive, we have that platform on Telegram. Consider joining. You're going to get a response from ATG doctors. So say, please, doc, I have 3 CS successfully. Can I add the 4th one? Yes, of course. The only issue with cesarean delivery is that it gets more difficult. If you've had the same doctor, the doctor, if you ask him that, doctor, what do you think about my cesarean delivery? If you have kept with the same doctor over this last 3, the first CS was likely the easiest for him, because everything in the womb is still in their normal anatomy, their normal position. Nothing is out of place. It's easy. He's able to predict what he's going to meet. The second one may be a little tough. Maybe there may be some adhesion here and there. You needed to cut some other, some adhesions, and all of that before the CS. Then the third one is building on the second one. Every time there's a surgery, the body needs to heal, and it's by scarring, so it becomes more difficult. Now on the 4th one, that may be gangster. Your doctor may need to do a lot of work. A lot of things may be matted together. You may need to do a lot of pulling during. You can definitely. You can have a 4th CS. It's not part of what we recommend in ATG. If you had 3 CS, put a stop. But your doctor is able to. If a doctor is able to handle the 4th CS, why not go for it? It may be more difficult on him. You may see the doctor sweating more than necessary, because there are a lot of things to do. There are a lot of separation. There would have been adhesions everywhere. It's trying to separate them and get it. So once how can one register for the ATGN classes? We have it. Our moderators, Elizabeth, has been posting some of those links. If your mind is also asking you join premium, just type in premium in this group. When you type in premium, that information will pop at you. Or just type antenatal, type ANC, any of those words, you will see the information you want. Those informations will come right at you. Someone says, can a pregnant woman take Aldomet and need, I'm sure you want to write nifedipine tablet to reduce her IBP. Yes, she can. I believe that kind of the woman is under a doctor watching her. Hypertension is not something to joke with in pregnancy. I'm talking about experiences I've had when I had my twin. I'm talking about experiences I've had even in my family, losing someone to that. I'm talking about women that I've seen. Hypertension is not something to joke with. Asking about this woman, can she take? I believe it's not you. You just want to come and treat yourself on yourself. If you are the one, you are wrong. Every shade of wrong. You must be under that kind of woman. So I'm not going to assume it's you. You're asking in third person. So that kind of woman must be under a doctor that is watching and monitoring her. That a BP in pregnancy is not something to joke with. Doctor, please, I have had 3 times CS and I've stayed for 3 years. Is it possible to have twins? Anybody can have twin. If you have twin, there are some, we've had seminars on multiple pregnancy. We'll tell you who are those that are predisposed to having multiple pregnancy and the other ways you can have. If you have 3 CS, you can have twin, but man, that's going to be some tough one, because for twin, you need your tummy to distend, and you've had this womb cut 3 times. The integrity, it can't really be trusted. I mean, can episiotomy form adhesions like in CS? No, because episiotomy is like you're cutting through some muscles, out there in the perineum. It is sutured, and then it doesn't really have adjacent structure it wants to stick with or adhere to. Doctor, after a week plus CS and the scar is showing round wounds at the base of the thread, used with little creamy pus, and methylated spirit is used in cleaning, and the pus stopped and the wound looking dried, does such person need to visit hospital since the pus has stopped? I would just assume that, because you had a pus and then you cleaned and then it stopped like that, it's just away. It may and it may not. If you look at the state of the wound, do you think the womb is healing well? Is it granulating well? Or is it hypergranulating? You need to go, because if you had a week plus, you're supposed to be checked. And normally after cesarean delivery, you're going to be checked in 2 weeks. I still remember in Nigeria, you're going to be seen postpartum 2 weeks and then again at 6 weeks. Or no, at 4 weeks again. So you should follow up with this appointment, let your doctor see. If you think something is wrong with your wound healing, be very sure that you beep up your doctor. 12 scan and they said there is no baby in the sac. It's possible. Your doctor may just ask you to give it 1 or 2 weeks and rescan again. If nothing is seen after then, it's likely you had blighted ovum. The baby stopped growing or the baby never formed. You may need to be evacuated. I'm sorry. Doctor, please, after a week plus, okay, I just answered this. Doctor, can I travel by air during 3rd trimester, 32 weeks precisely? Well, I'm going to need you to take permission from your doctor. He knows your history. He has a history better. I'm not going to... Do you have hypertension? Do you have diabetes? What is your weight like? Are you obese? Well, a lot of things the doctor is going to put into place. If you're someone that you have a perfect pregnancy and your weight is in check, you've been walking around and all of that, I think it's okay. And then the flight, if it's going to be a very long one, I'm going to advise you to get a compression stocking, because when you sit for so long flying, you are at risk of forming clots. Like I said earlier in the presentation, pregnancy is an hypercoagulable state. It makes it easier for you to form clots. So be very sure you wear compression stocking, because you're going to be sitting for a long time so that you don't form clot. And if for any of these clots it gets detached and then goes to the lung or goes anywhere, you can actually have embolism and can be serious, fatal. That's why some people will just say they saw a pregnant woman. Usually maybe the woman is kind of she's obese, she's big, or she's been sitting down for so long, she's someone that sits down, or she's had some issues. The woman was fine, she just started gasping, and before you know, she's done. It may be embolism. She may have formed a clot, and then the clot detached and then went to clot her lungs, and she could not breathe. So it occurs. This thing happened. If you're going to be traveling by air and you're going to be, especially if it's a long journey, get a compression stocking. Doc, please, what could you say about this drug, Glomoral and Paludel? Likely you've been seeing a gynecologist. Follow up with them. What do I have to say about them? They are fertility drugs. Follow up with your doctor. Are there drugs to take to have twin? Of course, there are drugs that some people take, and this has to be under with your doctor. There are ovulation inducing drug. It makes it increase their chances of twinning, and it has to be why those drugs can increase that chance. In them, it also increases the chance of hyperstimulation of the ovaries, and it can be deadly. You can have fluid in your lungs. You can be bloated like anything. So it has to be under the watch of your doctor. What causes body itching in late pregnancy? Oh wow! I'm going to have you check it out with your doctor. Be very sure you don't have cholestasis. That's you're having issues with your gallbladder. It can be something serious in pregnancy if not taken, if that is what you're having, or if you begin to see that you have your eyes are yellow. I mean, you need to take it serious. Let your doctor be sure that it's not. One of the causes that you can have itching again is that your body may be dry if you're not moisturizing your body. That sounds mild, but I will want you to check with your doctor and be sure that you are not having cholestasis. You have to have it under check. I'm really learning. God bless you. Okay. Thank you very much. I'm happy you're learning. Doc, do you advise older women to opt for vaginal delivery over 45? Now, it depends on your doctor. You can have delivery. If your health is okay, you don't have any problem, and you've been healthy, because that's what we keep saying. If you're someone that you're healthy, you're not hypertensive, you're not everything, you can give it a shot. If it goes wrong, then you can have, something is going wrong in labor. But to just assume based on the age for a woman that is healthy and fit is not enough. You can give it a try. But like I said, your doctor has this say. If he's comfortable with it, go with it. Can I still have a vaginal delivery after emergency CS since 2017 due to big baby? How do I avoid that? Because I'm 2 weeks gone now and I'm scared because I've had big keloid the last time and it's still itchy. One of the things you have to do, first of all, join ATG, because we have articles there. I share intermittently about your food, and I share on this page too foods that you need to eat, things you need to stay away from. If you had a big baby before, were you screened for diabetes? There are some things you have to check, to be sure. And then if you had your keloid, does not mean it's not going to occur again. You may not be able to, avoid that. But can you still have vaginal delivery? Yeah, it's possible. But then you have to be sure your baby is normal in weight. Like I said, your pelvis is okay, and you're not having some other conditions that can make it difficult for you to go through vaginal delivery. Someone says, I've had one CS and since then I've been getting miscarriage. What might be the problem, or is it a complication? CS is not known for a cause of recurrent miscarriage, except there's something else that occurs. But you have to follow up. If you're having an issue, follow up with a gynecologist. Follow up. You need to get checked. Don't just think it is the cesarean delivery. I had ectopic pregnancy, went for surgery, CS delivery after 2 years. Can I still have a vaginal delivery? Talk with your doctor. You've had one surgery and you've had ectopic. That really did not likely. You didn't have to cut through the womb. The doctor can try, can give you a VBAC. But like I said, your doctor has to be comfortable with this. Doctor, please, how safe is epidural injection to ease labor pain? It's safe in the hands of your doctor, in the hands of an anesthesiologist. It is just cool. It's just one of those procedures. It is safe. Can one have a vaginal delivery after 2 CS? Thank you. It's like just joined in. Gloria. After 2 CS, no, don't try vaginal delivery. Please don't. Can CS cause a delay in getting pregnant? Like I said, except there are complications that may have caused, that you have infection and then you had adhesions after, or you've had adhesions that were so serious, displacing the location of ovary and the fallopian tube, and, which rarely occurs in the hand of an expert, So if, except those kind of stuff happen, no, it does not cause infertility. Please, doctor, what can cause ectopic pregnancy? One of the causes of ectopic pregnancy, the commonest cause, usually from scar tube, a blockage in the tube, and usually due to PID. You had a long-standing reproductive tract infection, or you had a way where there was an infection, you had infection in your pelvis and all of that, and there are blockage in the tube. It makes it hard to go. There are some other rare ones for which a woman, maybe you have issues with a woman's, tube not being able to bring the pregnancy to the womb, the cilia of the tube is not able to do its job. It can cause ectopic pregnancy. So, while in some women, the reason is not just known, but the commonest cause is PID, or previous infection. Doctor, can one with umbilical hernia after CS get pregnant without complication? Of course, why not? The fact that you had umbilical hernia after cesarean section doesn't mean your pregnancy has to be complicated. Doctor, if someone had episiotomy, can it affect next delivery? How now? No, it doesn't. How does it affect next delivery? If it's well healed and it's okay, and everything should be cool. Can CS cause a delay? I think I've answered this now before. Well done, doctor. You're doing a great job. Thank you. Please, doctor, what causes seizure during delivery? That's called eclampsia. Whenever a pregnant woman convulses, it's called eclampsia. And usually, if you look on the line, one of the common thing with it is that the woman may have an uncontrolled high blood pressure. That's an alternate, it's like a phase from that woman. She likely was having pre-eclampsia. I've had a lecture on preeclampsia before. Like if she had preeclampsia that progressed to eclampsia, it's possible. It can be very frightening, both to the mother, to the doctor, to everybody. And every woman that comes out alive in that, I mean, they need to go for Thanksgiving in church. Some women from there, they never can return. I mean, it's a painful thing. So that's why I was opening high for that woman that was asking me about high blood pressure. No woman should joke with high blood pressure, whether you have delivered or not. You must be certified after delivery that you are fine with your BP. Don't just assume because they say I have high blood pressure, I've delivered, God has shamed the doctor. God no go shame all of us. Go back and be sure that blood pressure has really been controlled. I mean it. I mean it. Don't play don't toy with your life. Doc, please, what can cause breech babies even after pelvic entry shows normal? The position of your baby is that's one of the things that you don't have a right over. Your baby will determine their presentation. But one of the causes that may predispose them is if there's anything in the lower region. I mean, if there's anything, if you have placenta previa, the baby is just feeling there's something down here. I mean, I'm not going to put my head here. Or there's a fibroid down, something. If there's anything, it can cause baby to present. Oblique, can cause baby to present transverse. Baby is just feeling, why is this fibroid, you poke my head. Let me turn head up, you know. So if you had anything that is down there, if you have placenta previa, you have fibroid in, it can cause malpresentation. And the position of your baby, there's really nothing you can do about it. And I forgot a part of this presentation, this question that I just talked about now. Talk about one of the ways that it's been tried all over to reduce the incidence of cesarean delivery is to do something we call external cephalic version, where you try to turn the baby, you know, from outside the womb like that. You try to turn the baby. This is usually more successful in women that have had babies before, because you know the abdomen is more lax, it's kind of more relaxed, so you're able to try. Some will do epidural for the woman because you want to reduce the pain. The doctor tries to turn, like a baby that is breached, they want to try to turn the baby. Ouch. It can look painful. A lot of usually newer doctors may not do it. Usually the doctors that want to do that, you know, like our profs, they are very confident about such kind of stuff. Newer doctors just want to save their head, and you're going to be advised to go for cesarean delivery. But with external cephalic version, the doctor that is good at it, if the doctor can do external cephalic version, he must be a boss. I mean, and he can watch. After external cephalic version, you're likely going to be watched. Your baby is going to be monitored for a while to be sure there was no placenta abruption, because that's one of the things that's usually more the complication that is feared. Rarely occurs, but it's common. But it may occur. That's not common, really. So we want to monitor the baby. The baby is not in any distress. The baby is not, you know, the vitals of the baby is not doing anyhow. Then you can, okay, woman, you can go home. If you fall into labor any moment, return. And that. Someone says, can I ovulate without knowing? Of course. A lot of people ovulate without knowing. I never knew when I ovulate. Never for once. Always having severe waist pain ever since I gave birth 2017. You need to follow up. Tonight you've been having this question about your cesarean delivery. You may have had complications with that. You need to go back to your doctor, especially the doctor that attended to you. Tell them about all these symptoms you're having. You may want to check your case notes. You want to check your surgery notes. Maybe there was something that went wrong. They themselves may want to tell you. It's a doctor's stuff to tell you. During the cesarean delivery I had with my twin, my doctor had to tell me, during delivery, you bled so much, doctor. You bled. And then I had to, you know, so it means I knew I had to increase, you know, my fluid intake, my iron, you know. They told me, but I think you're going to be fine. You're going to be, but if there's any difficulty that was seen during procedure, your doctor is going to tell you. So there may be something that is in your surgical notes. Maybe there were more things they saw that may actually be a clue to the stuffs you're having. Your doctor will help you out. Doc, when is it possible for me to have my period after CS delivery? You know, just like any vaginal delivery or cesarean delivery, it may take longer, but your body needs time. I can't give you a time that you will find your period after now. But the way we regularize differs from person to person. Your body is going to give you the signal. When it's ready to regulate itself, it will do its job. But what you need to do is eat healthy, especially if you're breastfeeding. It may take longer for your period to return. So just eat well, expect it, and be calm. I'll be taking just some few questions more, and I'll be ending for today. Like I said, if you're pregnant in ATG, you should be in ATG ANC. ATG Antenatal, you should be there. I mean, that's We share knowledge with our women. We want women to have questions. Some will tell you, doctor, tomorrow is my antenatal. Do you think there's anything I'm supposed to ask my doctor? Based on the information we have, I'll tell them, okay, about this, your result you sent, and this is an ask this and this. And then some, I think you're good. Just go. Whatever your doctor says, let me know. And if you're pregnant in ATG, you should be in ATG antenatal. Even if we're not able to answer your question, I feel for a lot of people. They may join this presentation and they discover that some will tell you every time I join, they don't get to answer my question. We're not beefing you. Sincerely, we're just being lucky. I don't want to use the word unlucky that your question is not being answered. Subscribe to premium service. It is our responsibility to answer you. Someone says, can I ovulate without knowing? Oh, I answered that question. Can a woman with 4 fibroids try vaginal birth, or would you advise this section? Having GD, I want to think of maybe gestation diabetes. I don't know if you talk about that, and low-lying placenta, which is still being monitored. Man, with all these things adding together, my sister, let's just go for cesarean delivery. A low-lying placenta still being monitored, yeah, because with time, depending on you didn't put your GA, so I'm not be able to say about that. All of this I'll be able to have been able to ask you if you're an ATG antenatal, but you're not. Man. So the doctor is going to look. Maybe you have placenta previa, maybe it's still previa, or it gets to move as the lower uterine segment is being formed. The doctor keeps monitoring this, and then with gestational diabetes, and then you have fibroid. There are so many comorbidities with this stuff. The doctor will likely ask you to just go for cesarean delivery. Doctor, always feeling weak. My baby is 4 months. I had CS. Are you sure? Are you sure you're eating well? Are you sure you're taking prenatal vitamin? You may have lost so much blood. Like I told you, like I had that. I had some people, you lose so much blood. CS is one procedure that can make you lose so much blood. Then for some women, it can be abnormal. You bleed more. So did you lose so much blood? You may be anemic. So that may be causing you to feel so weak and all of that. CS is not supposed to cause you to be. By 4 months, you should be fine now. You should be on your leg. You should be moving. So if you're still feeling weak, you should go and get a PCV. Talk to your doctor. Get a PCV. You may likely be anemic. You may need to eat more vegetables, green leafy vegetables. You may need to have iron being given to you. So to build up your blood level. Thanks, doctor. What about feeling pain on the question is gone. The please is ouch. What about feeling pain on the left of your buttocks as if you have muscle strain? I don't understand. Is this pregnancy related or you just have pain? You should discuss this with your physiotherapist. I don't know how to put this. I don't know how to factor this. What causes painful intercourse during pregnancy? Like you already mentioned, during pregnancy, you have hormones. Progesterone is high. So usually you may have your vagina maybe more dry. You may need to, you may need to get lubricants that are safe, and you may need to master the act. Don't just penetrate, like immediately penetrate. Do all the foreplay. Be sure that you're ready before penetration occurs. And pregnancy itself may make you disinterested in sex and everything, and can make it more painful. But do the job. Someone say, please, a lot, doctor. Please, how do I register for premium package? Just type in premium. Moderators, they have posted the link earlier, but I haven't been seeing them recently now. But they have posted the link earlier, but you can just type in the group. Just type premium, or at actually the very first post at the announcement section in this group is the information you need about our premium service. Please, doc, is there anything a CS mom can take to take out fibroid without going for section? How do you want to take out fibroid? I mean, fibroid, if you have fibroid, you remove it either surgically, or if you're now almost close to menopause, you can have a medical, treatment. You give drugs those drugs are going to make you stop menstruating. They're going to knock out your fertility for a while. So you can use that to buy time till you enter into menopause. But if you're still in your fertility, you still desire pregnancy, and you have a fibroid that is disturbing, you need to get it out. It's too surgery. Please, doctor, how long do I contract before going to see a doctor? I'm 37 weeks gone. I mean, the truth is, if you may be having Braxton Hicks or false labor, but if you're having a contraction and the contraction is increasing in frequency, that is occurring more often, and it is serious, like the pain is increasing too, the intensity is increasing and the frequency is increasing, you're likely in labor. You need to head to the hospital. Doctor, this is my first pregnancy and I'm so scared to go through CS, but I'm 5 months now and I don't know if there are some advice you can give me to increase my chances of normal delivery. There's nothing special I'm going to tell you. First, join ATG and C, because we advise our women. That's going to increase much more than me doing that today. I may miss out on some information, but if you're in ATG and C, you get to have me talk every day. If I miss out any information today, you get that tomorrow, you get that the day after, or it's already talked about in the group that you can read. But one of the things is that you have to be active in pregnancy. Brisk walking, stay active throughout your pregnancy is going to help you. It's going to increase. Do your Kegel exercise. Every time I talk about Kegel exercise in ATG, it reminds me to do the exercise too. Like I'm talking to you now, I'm doing Kegel exercise. It's just a way you can contract your pelvis, but there are some ways you can lie down and then do some more intensive one with it. Do that. Eat healthy, more fruits and vegetables. You don't want constipation. Drink lots of water. You never want to catch yourself thirsty in pregnancy, because that can cause contractions. Dehydration can make you have a headache. A lot of things. So drink lots of water. Take your prenatal vitamins. A lot of things. So sometimes can a woman with triplet tri-vagina. The higher other pregnancies are indication for cesarean delivery. I really prefer you to go for cesarean delivery. But if your doctor is saying that you should try it, maybe. But personally, cesarean delivery, it is. This says, how do I join the antenatal group? Please, we have information in the group. Just type in antenatal in the group. Type in ATG antenatal. You're going to see it. It's a Telegram platform. Once you pay, it's going to give you a link directly both to the group and to me. And then we can start consultation. Doc, I keep having pains in my vagina after CS for 9 months. It can be due to healing, sometimes when you're healing, there's some pulling and all of that. It can occur, but it should not be forever. Or if it's still happening, like it's still occurring for so long, it may be something due to adhesion. Maybe it's adhered to a part of that is pulling in your vagina. If it's so painful, you can take paracetamol for it, but it shouldn't be so painful and overwhelming. But if you think something is wrong, you're having an instinct that something is wrong, talk to your doctor. Please, is back pain normal after 2 CS delivery without epidural injection? You can't have CS. You can't have CS without spinal or general anesthesia. Those are the 2 ways you do CS. These are spinal, not epidural. You don't use epidural for CS. You use spinal or general. So if you've had that, some pain, you may feel some pain, at the back, because you had to have this, the thing choked into your back. Ouch! But usually it's not so unbearable. You can have the pain. It may take a while, but it will go. It goes away. Doc, please, I have been feeling stiffness of my finger as if blood isn't flowing through after delivery, and it's becoming worse every day. Do you have fluid retention? You may be having carpal tunnel. You may need your doctor to look, because there are a lot of things you can't diagnose online. You need a doctor to check. You need to examine you and reach this diagnosis. I'm just going to take 2 more questions, and that'll be, Doc, can fibroid stop someone to get pregnant? Yes and no, depending on the type of fibroid and depending on its location. If it's a fibroid that is, subserous, is outside the womb, they may not cost you, they may not have any issue. But there are some fibroid that probably they are close to the cervix, or they are big, they're actually blocking the cervix. They may make it hard for pregnancy to occur, or they are kind of close to the tube. They are even blocking the tiny tube. It may be, or if you have pregnancy that is trying to implant on a fibroid, may cause miscarriage. They're not so common, but it's possible. If you don't have any other issue that every other thing looks right with you, your hormone is fine, your husband is fine, your tubes are fine, everything, but just only fibroid that is left and you can't conceive, then your doctor will say, okay, let's remove this fibroid. But every other thing else has to be right before you just think of fibroid as a cause of infertility. Doctor, is it safe to have more than 3 CS, interval of 2 years each? More than 3 CS is your choice, is your body. I believe you've had 3 major surgeries. It's just wise to put a stop to it. But because for every more surgery you have, it gets more difficult. The higher the likelihood of your complication, the more tasking it is for your doctor. But like I said, it's your choice. But we just have to. But 3 CS, I think it's just wise. You've had 3 major cesarean delivery, 3 major surgery. Please, what could cause serious waist pain in pregnancy? Join ATG and see. You likely may be having a round ligament, or you may be having symphysis pubis dysfunction. I will need you to describe the pain more. That would be able to help me reach that, because if you're an ANC, I'd have asked you more to describe, and then okay, this is likely what you have, and then take this to help with the pain. But if the pain is so much, take paracetamol. But if it's so severe and you think it is cracking, you just can't hold on to it, please present to your doctor. You may need to be referred to a physiotherapist. All right, so thank you very much today. For those who stayed back, you're still listening to me. So thank you very much. I do hope I was able to answer your question as much as I can. Those are able to. If I'm not able to answer your question, I'm sorry. I'm so sorry. I didn't deliberately leave the question, but I can answer every question, and I have to go. So please, if you're pregnant, consider signing up with ATG Antenatal. It is very important. We don't want to have anybody in ATG lose their baby on preventable causes. It's going to be painful. You're just making it look like our labor is in vain. Consider joining Antenatal. If you're pregnant in ATG, if you're one of those that are going to conceive, we want us to work with you on this journey to defeating fertility. If you want it on the general platform on Telegram, that's the GTC. Sign up for that. If you want a one-on-one consult with ATG doctors, type in our premium service. You can have a direct contact with us on WhatsApp with ATG doctors. Sign up for premium service. We're here to serve. We're here to, to give answers. And, it's our joy every time we see those testimonies. I listen to your teaching. Now I'm pregnant after how many years? Now you told me to go for, to monitor my baby. It was just in time. They were able to rescue my baby. All of those make us happy. Thank you very much.